Now we'll discuss the parental pamoate. This parental pamoate is a antihelminth. It is effective against roundworm, hookworm, pinworm. Since it is poorly absorbed from the gut, it acts on the worms in the gut. It is poorly absorbed from the gut, and that's why it acts on the worms which are present in the gut. It stimulates the release of acetylcholine. The mechanism of action is totally different from the albendazole or mebendazole. It will going to stimulate the release of neurotransmitter, which is the acetylcholine. That neurotransmitter will activate the nicotinic cholinergic receptors in the worms, and that leads to the persistent depolarization, spastic paralysis of the worms because of the depolarizing neuromuscular blocker. That drug also inhibits the cholinesterase enzyme. Means basically we'll see the mechanism of action in detail. What does it do? Parental pamoate. It stimulates the receptor. Why? Because it stimulates the release of acetylcholine. So that acetylcholine will going to stimulate the nicotinic cholinergic receptors in the worm, and that leads to the persistent depolarization. Persistent depolarization leads to the spastic paralysis of the worms, and that worms will get expelled. Rather than killed, they will get paralyzed and they will get expelled easily. So these are the vermifuge, not vermicides. Parental pamoate, it's a vermifuge. What does it do? It stimulates the release of acetylcholine. That acetylcholine will act on nicotinic cholinergic receptors in the worm. That will lead to the persistent depolarization, spastic paralysis of the worms, and that worms will get paralyzed and they will get expelled from the body. This is how they act. This parental pamoate is very well tolerated. Occasionally abdominal pain, headache, rash, weakness, dizziness may occur. Single dose yields high cure. Single dose is enough. Uses where we can use parental pamoate is given single oral dose 11 milligram per kg. Dose is slightly different. It is given as a single oral dose 11 milligram per kg in the treatment of roundworm, hookworm, pinworm. For pinworm, the dose is repeated after 2 weeks because there is a chance of reinfection because that ova mature later. Oxantal pamoate, an analog of parental pamoate, is effective in the treatment of trichuriasis infection, which is the analog, oxantal pamoate.